Well, here we are once again on a Monday talking with Minister for Health and Social Care, David Ashford, although we didn't get you last week, which is interesting. All the times during the pandemic, we always found time, but now everything's kind of getting more relaxed. You're rushing around doing other things,
The diary went absolutely hectic last week. I don't know what it was about last week, Paul. It just exploded.
Okay, so no conspiracy theories?
No, we didn't want to do the Monday because we'd done one not long afterwards,
That's
I think,
right.
was it, before previous. So I think we were hoping to do Thursday, and then with one thing and another, it all went off.
Well, I'm glad I'm unmuted now. Boy, that's a joke if you watched the press conference. I was talking, but you couldn't hear me initially. But that, again, was just one of those things.
And in person as well.
In person. Well, I don't know where we're going to go much more, in a minute, because obviously things are changing by the minute as far as settling down. I think the interesting bit is the app, I suppose, because didn't you always say we were never going to do an app here or join the UK or do anything
Well,
like
the
that?
app was in relation to contact tracing, if you
Right.
remember, when we said we
That's
have
a separate one, isn't it?
Yeah, we have a physical contact tracing team that is much more efficient than an app, because an app you can't legally enforce the quarantine off the back of that, because you're not entitled to the data of someone's personal data as to who's been contacted by the app. Mm-hmm. So we've always stuck with physical contact tracing that has served the island well, but obviously in the UK, population of in excess of 65 million, there's no way you could do physical contact tracing in the same way we can with a population of 85,000.
So I've downloaded it. Have you done yours yet?
I have. I had mine for quite a while. So
you
it's
were one of the
down.
testers, were you?
No. I've just out of interest have played around with it for quite a long time.
Very interesting. I mean, the security seems pretty top end. You have to record your video, give you a number, give you the picture from your passport. So everything, it found my NHS number, because I wouldn't have a clue what that was. It found my doctor. So everything seems to be together, but obviously we're not quite at this last stage, which I suppose we're too early anyway, are we? When will it go live that we can
so NHS Digital is due to hopefully set us live in the next 7 days. They've been doing some work for Wales over the last week or so, and then we're the next priority after that in terms of NHS Digital. So people in terms of the proof side of the vaccine, on their primary care record side, they'll be able to already see the vaccine, but the bit that they need for the proof on the app, that side will go live in the next 7 days.
What does it give you, this app?
Well, it makes it much more efficient in order for travel purposes. Right. Now, obviously, we recognise not everyone is tech savvy, not everyone works with apps. I've got family who don't even have a mobile phone, so there will be able to be paper copies requested as well with the formal barcode on for purposes of travel, and we'll shortly be announcing how that can be done as well.
Because you can leave the Isle of Man anytime you want, I'm guessing. It's just this way, coming into the Isle of Man, you have to show that at some point.
Well, the issue for residents isn't quite as much of an issue coming back, because coming back to the island, obviously we have access to people's patient access. Right. So we're giving them the vaccine in the island. So if we wish to corroborate the proof they're providing, we can easily do so. The app is more useful for those who are going to be travelling outside of the UK, because countries such as France, Greece, Spain are all starting to go down the route of wanting digital proof. So that's where the NHS app becomes useful, because there is, Isle of Man residents are free to go into the UK. There's no barrier there. Coming back to the island, well, we have access if we need to corroborate.
Where do you show it? Will it be at the airport? Will it be some sort of part with your passport almost?
So it'll be coming in, yes. Coming in, you'll be asked for proof.
And access to other countries, the airports, airlines will be looking for this bit of information before you fly.
Well, that will be up to the airlines.
So each country could be different.
Each country could be very, very different. I mean, so for instance, I believe France has said they need specific type of information, and I think they're even asking for a QR code that the NHS app will provide when it's up and running. So I think each country is going to have very different regulations, so it is important before people travel that they're aware of what the stipulation might be in the country that they're going to.
So after the 28th, come into the Isle of Man, as you land or you come in by your ferry, how's it work there? You got somebody, everyone's going to be greeted like some sort of mini customs point now, will it be?
So let's be clear, but what people still have to complete a landing form before coming into the Isle of Man.
Before you leave?
So 48 hours before, that's the situation now for anyone coming in. Right. That is not changing, because we still need to know who is coming in and out of the island.
And how do you do it online or paper?
The online landing forms can be completed. They can be completed in paper format as well and handed in as you come through. That process has not changed.
And not going to change.
And double vaccinated individuals will still need to complete a landing form, and that is the point where they will make the declaration about being double vaccinated.
So this form, so I've never been anywhere yet. You do it on your online or whatever. It stays on your phone, does it? You just show it to somebody as you arrive, or you submit it.
You submit the form, so they can be found off the COVID-19 website, covid19.gov.im. If people go to the travel and borders section, there is the landing form section.
And you do it 48 hours before.
It's recommended to be done 48 hours before travel.
You can't actually get on a boat or a plane without that information being held. I mean, does the airline or the CPAC know what's going on?
Yeah, upon arrival in the island, you need to have a landing form.
So you could get all the way to the island before. So
you're like me, Paul. You haven't actually travelled.
No,
I haven't been anywhere either. I haven't even managed to get to Guernsey, unfortunately.
But it's quite interesting actually to hear the process.
Yeah.
I mean, you know.
So people coming into the island have always, since the pandemic really began, had to complete a landing form with various declarations, and that is exactly the same situation now.
So someone greets you. That's what I'm trying to say.
Yeah.
And they say, "What's your name?"
Yeah.
Oh yes, we got you.
Yeah. It's not just a case of people get off the boat and come in.
And then that person who hasn't even thought about it or doesn't know about it, what happens to them? They sent straight back, or are they put into quarantine, or will they never get that far?
Well, it wouldn't get that far. It's the process of having to complete the landing form before you travel.
How long is this likely to go on for?
Well, how long's a piece of string? I mean, I'd love to get the crystal ball out, but it's looking a bit foggy these days. Yeah. But we're hoping to move forward. I mean, this is another interim step, what's happening on the 28th, and people should view it as that. It's not the final model. It's not saying this is it forevermore. We wanted to open the island up more, but we want to try and do so in cautious, safe ways. So a bit like the 2.5 that we ended up with, as I coined it, where we didn't end up going to the full level 2 because we felt that was taking too far of a step. We went for the 2.5. This is the next step. And then as the situation evolves over the coming weeks and months, we will assess again and change the regulations again. Well,
actually, during that press conference, it literally came up that Jersey had altered its status for England. I mean, that was quite a big bombshell in this way. I know you were busy checking as well. I mean, what's going on? I mean, other places are almost like pulling back from opening up, and we're still on the process.
Well, Guernsey is going down a similar route to us from the 1st of July, I believe, is their date. Jersey has always gone for this traffic light system. The way that it used to be done with the traffic light system down there, it was done by local authority region, but that was a bit messy, should we say, because of course there's over 360 odd local authority regions in England alone, so each one could have a very different colour rating.
Jersey got us wrong anyway, didn't
they? So we've got to do what we believe is right for the island. The science around double vaccination is becoming exceptionally encouraging. Now, that's not saying it's risk-free, and I need to be absolutely clear on that, as the Chief Minister has been absolutely clear. It is not risk-free. There is still risk attached. There is risk attached to everything that we do. But as an interim measure, as we move forward towards eventually being able to reopen our borders and get back to normality of travel, this is, I think, a good interim step along that way.
It's got nothing to do with Timble Day, has it, and getting all these dignitaries in from the cross or something?
Far from it, Paul.
Aren't there going to be a whole load of people waving goodbye to our President and the Chief Minister?
Well, we don't arrange things. We don't arrange things around Timble Day, as was seen last year, because we actually basically, even though we'd come out of lockdown by the time we reached Timble Day, if you remember, not long before, we still had the powered down ceremony and everything else because we'd cancelled everything.
Are the airlines receptive to what you're doing? I mean, I'm seeing there's EasyJet bookings there, but I don't know if they ever go ahead or not.
Yeah, I mean, the airlines will have to make commercial decisions because that's what they are at the end of the day. They're commercial operators.
Are you ready down the airport? You're clearing the area up?
We've given, obviously, the vaccination centre's still up and running down there at the moment. There's still sort of...
When's that going?
I think it's 1st of July, or 4th of July, sorry, 4th of July.
Oh, so it's almost
done. Is the last session down there. But, the airlines will have to make commercial decisions. Some airlines may well decide they want to wait and see, that at the moment it's not either financially or commercially viable to be operating services like they were before. And so what you might find is that rather, it's not going to be a big bang. Services aren't going to suddenly, at the click of a finger, come back at the end of June. It may be a staggered approach over several months.
And still the debate about which vaccines to give. I mean, I have Australian friends, and so I watch quite a bit there. They've really gone against the AstraZeneca completely. I mean, they literally, no one seems to want it, and they're way behind on the whole thing, so they're waiting for the Pfizer. this isn't just to them, of course. We keep hearing these dangers.
Well, different countries have to make different choices. There is risks with any vaccine.
How are you doing here, then?
Compared to balancing out. AstraZeneca is actually the most widely used vaccine around the world. I think it's over 130 countries.
You still get people that are rejecting
being used in. Yeah, people are trying, but we have to be clear. People can't pick and choose. The vaccine that someone is offered is based on stock. It is only if there is a specific medical reason due to a condition someone is suffering from that we will allocate a specific vaccine.
And what age are we up to now with everybody? Because in the UK they've been advertising 18-year-olds.
Yeah, well, we've been there for over a month.
I thought we were, but
month and a bit. I think month and a half.
Always, label it when I say they're doing this, and you say, yeah, but we're actually doing it, or they just
the entire adult population is able to register for a vaccine.
And we're on schedule then, are we, for the full?
Yeah, we are on our time scale that we said we would be on, and we're now focusing on the second doses. We are still administering first doses for those who are coming forward, but I would urge anyone who hasn't already registered to register, because the issue we have is the UK will be slowing down its vaccine programme, this first phase, to concentrate on boosters later in the year. People will have seen the headlines this morning about a booster programme, and that will affect us as well. And the vaccine stock has a shelf life, so it's not as if we could stockpile a load of vaccine if people come forward later, because it will have gone out of date. So we need people to come forward now if they're wanting the vaccine in this round, and the booster programme, if or when it does come forward, will of course probably focus by age group again, starting with those most vulnerable and working the way down.
Do we have, is it 6 months or a year, or do we know yet where that's going to be?
No, it's all to be decided yet. We obviously are in negotiations with the UK over this, and we're talking to them about that booster programme, but the details have yet to be confirmed.
So Chester Street will be in use presumably for some time, or will it go down to GPs eventually, or what?
Well, that's one of the things that we would have to look at. Right. One of the things that will drive that is how transportable is the vaccine, because you'll remember the conversations we've had about how these vaccines have to be stored. What will also drive it is the security behind it. I think again we've discussed previously that this isn't just a case of produce a vaccine, put it in someone's arm. There's lots and lots, dozens of protocols that have to be followed, even down to how the vials and the cardboard boxes they come in are disposed of. Obviously, if those arrangements are in place, it might be more efficient to do it at one centre. If the arrangements around it is more like a flu vaccine, then obviously that opens up the possibility of GP surgeries and other ways forward. But it will depend on what is the final position around what the vaccine is.
We'll talk about people who don't want it, want to switch to that. But what about the people who don't have it at all? They've been treated as second-class citizens. It's like you're forcing them; they can't travel without spending a lot of money on. Okay, yeah, go on.
I don't actually disagree. I don't agree with that. So right. I don't actually agree with that. I disagree with that. And the reason is, if we were talking about a month or so ago, actually, personally, I probably would have agreed with you, because the alternative would have been 14 days isolation or 7 days isolation
and £150
and 150 quid's worth of tests.
Yeah.
The actual result now is it's one test, so it's £30. It's been reduced down to £30. It is one test. Once that test comes back negative, the person is released from isolation. Now, most test results are back within 24 hours, or at a maximum generally 48 hours. So the period of isolation, if someone's come back off the boat or off the plane and has gone up to be tested, is radically reduced from where it was. But I need to point out again, this is an interim step. So we're not turning round the case is going to be forevermore. That someone's double vaccinated, so they'll go down this route, you're not vaccinated, you should go down that. The aim is to get to a point where everyone travels freely, back to normality.
Of course, those people still won't be able to travel internationally because other countries have got their own regs.
Yeah, exactly, and that is the issue. So it's another step on the road. And I think, when we have the science now around double vaccinated individuals and the risk that they pose, it would actually be rather ludicrous for us as a government to be turning around. In fact, you could argue it's discrimination the other way and say there are people who've gone through the double vaccinated process. We now know in the science they're reduced risk not just of transmission, but also there's now reports coming out about it reduces the risk of them catching COVID in the first place. If we completely ignored that and said, well, actually, no, you still need to isolate when you come back to the island, it could be argued we'd be discriminating against vaccinated individuals.
University students, will they be double dipped in time, or how's that looking?
It's highly unlikely because of where the UK has got to.
So what's going to happen?
So it will be the 24-hour test and release for
and
them.
Can they get their second one in the UK if they haven't already had
And
it?
again, it's mix and match in that way. So it's a reciprocal agreement. So if they've had their first on Ireland, they can have the second in the UK. If they've had their first in the UK, they can have their second on Ireland. And we've been running the student vaccination programme as well. So we've done the first batches of the student vaccination programme, which saw a good uptake with the Moderna vaccine, and we're doing those with an 8-week gap, which means that basically those students will be vaccinated both vaccines on Ireland before they return to university.
And the school children, what's safe, what isn't safe, what is going to go on there, because obviously lateral tests and lateral flow tests were being talked about in schools, that sort of thing. Where are we up to?
Well, again, lateral flow, let's be absolutely clear, that is a surveillance test, and it is voluntary, so it's not a huge project across the schools.
But they can have 2 weeks or something.
The parents, if they wish to take them, can have two per
parents
child.
or children? Who takes it?
Well, the parents have to opt in. The child can't opt in themselves, Paul.
Got it. But the child
so it's
takes
for
the
testing
test,
the
not the
testing
family
the child.
take the test.
No, it's for the child. They can have up to 2 tests per week that the parents can obtain for their children. But it is completely and utterly voluntary. It's, lateral flow is very good for surveillance testing.
What percentage now you're going to give it out as a good
Well, the technology
indicator?
is actually moving on lateral flow, so you can
if you get it right, you know.
If you get it right,
because this is a problem, isn't it?
And that is one of the reasons why, again, I said at the press conference on Thursday when lateral flow was raised, I can't remember if it was you or one of the other journalists that raised it.
Well, when you can hear
but what one raised about lateral flow anyway. Forgive me if it was you. I don't think it was. No. But in relation to lateral flow, it's very good as surveillance. You still wouldn't necessarily use them as your primary testing. So if you had someone who was symptomatic or someone coming in for their first test, we're concentrating on still doing PCR because that is the gold standard, is the accurate test. But lateral flow is in the mix as something for a surveillance programme, which this basically is.
Up at the grandstand, we've still got this unit there. This has to go, doesn't it, now? Because, once the border's open, it doesn't... Well, does it?
People still will need testing coming through. So obviously, usage will go down because as the amount of double vaccinated people goes up.
So no, they can't request one then, can they? It's only the people who...
No.
There's no more requesting?
There's never been requesting in terms of tests. Right. People could purchase private tests for international travel, but nobody has been able to turn around and say, I wish to be tested. It's always been a case of if you're showing the appropriate symptoms. That's been the case throughout the pandemic.
So will it stay up at the grandstand, or are you going to find
So at the
somewhere else?
moment it will stay at the grandstand. It's a very efficient operation up there, and the team up there has been doing an absolutely excellent job. They've done it through literally all seasons now. They've gone through winter as well up there. They process people very efficiently, very quickly, and it also provides one job batch to go up to the lab, which makes it more efficient from the lab's point of view as well, rather than it coming from multiple sites.
One question I did ask when you could hear me on the last one was that about the boats and ships coming in, and it was really hard in that limited time to try and explain exactly what I meant. But some of the boat shipping companies are only taking people who are double vax, but others aren't going to do that, and that's where I was trying to get to. Like if they joined in Germany or whatever, they get on this boat, they're on their trips, whatever. I'm not talking about in the next few weeks, maybe just a few more months before it's fully up and running. What procedures will stop them, or aren't they going to be stopped if you're happy with them coming on?
Well, they will have to prove the double vaccination status. Right. It has been absolutely clear to the cruise companies. The only people that will be allowed into the island without restriction is those that are double vaccinated.
Who does that? On the ship, or will you be having people?
So the cruise company will have to be able to show us, all the individuals, either or, that those people coming up shore are double vaccinated.
And Ireland is in our area now, which some people are going, well, hang on, they're still a bit behind. Are you happy with
but don't forget the only people able to come in from Ireland are the double vaxxed. Yeah. So, a double vaxxed person in the Republic of Ireland and a double vaxxed person in the United Kingdom, it's still effectively the same situation.
And there will be repercussions for this. I bet your mailbox is jammed again.
I've been clearing a few down.
What's it looking like now?
It's like whenever we do changes, it's always about 50-50. Whatever we do with changes, you've got people who think it's discrimination. You've got people who think it's wonderful. It's always a mixed picture. So I'm not going to try and.
So you're the one always going, very carefully, baby steps, all this, bingo numbers we're having things, and you now sort of almost gone the other way.
Well,
It seems to some people.
Well, I think this is another baby step along the way, to be
Yeah.
honest. It's not what we were expecting or hoping for on the 28th, which was full release of the borders. I think after 2.5, as I coined it, I think this is another sensible release. We've kept most of the elements of 2.5. The only change is for those that are double vaxxed, and like I say, the risk around double vaxxed individuals, as is now being shown by the science coming out, is much more encouraging, and it's only right that we factor that into our border policy as we go forward.
And of course we have 0 at the minute, I think, last time I've checked. Any more updates on that?
It is still 0.
But it won't be forever.
It won't. And as I've said, we've got to get out now of this mindset, and it's difficult for me as well, because I've spent a year stood at a podium giving out figures and cases.
Exactly.
So it's just as difficult for me. We've got to get out of the mindset around cases. It's not about cases. And as I made the point again on Thursday at the conference, you could actually have 1,000 cases on Ireland, but if all 1,000 of them are well, your reaction would be very different to, say, if you had 20 cases on Ireland and all 20 of them were in the hospital. So the nuance now has got to be around the risk of serious illness and death as we move forward, because we do have to come to terms with living with COVID-19, and that's not an easy process to do, but it is going to be around for at least a decade or more, or forever, as most viruses are circulating. So there's no exact science for it. As I said in Tynwald when we had the debate, which was a very good debate amongst members around borders, and some members quite rightly were cautious and worried, but as I started off by saying, and as I started off in saying in my piece, now comes the difficult part. It's easy shutting everything down because you just close it. And now as we release and we try to give people more freedom, this was always going to be the difficult point, because it is a balancing act. And, as the Chief Minister has been perfectly blunt and honest with people, some things will work and will look absolutely perfect and be right, and other things won't, and we'll have to adjust and work off it. There's no set roadmap as to how you do this correctly.